Wonderful. Thank you so much. Good morning, good afternoon. My name is Dr. Stormy Monks, and on behalf of the Southwest Center for Pediatric Environmental Health, I want to offer you a warm welcome to today's presentation. The Southwest Center for Pediatric Environmental Health is one of 10 pediatric environmental health specialty units, also known as PACUs, in the United States. The purpose of the PACU program is to serve as a leading national source of medical information and consultative advice on environmental conditions that influence human health from reproduction all the way to through pediatric development. To serve part of our mission, we provide a Grand Round series once a month, typically on the third Thursday of each month. We are grateful that you've joined us for today's session, where we'll hear Dr. Dalia Nessim speak on climate change and its impact on children's health. Before moving forward, I want to thank our partners at the U.S. Environmental Protection Agency, the Agency for Toxic Substances and Disease Registry, and the American Academy of Pediatrics. Without these three entities, the work of the PACU would not exist. I also want you all to be aware that we have CME and CNE credits available for this series. In order to obtain those, we need you to log in with your registration ID and then to remain on the call for the entire presentation. You will be sent a evaluation and a post-test, and then that is going to help us get your CME and CNA credits to you. Just so you all know, our next Grand Rounds is going to be on October 26th. It's not the third Thursday as normal, it's the fourth. But we will have Dr. Jesus Diaz speak with us on radiological exposures in children. You can go ahead and use this QR code, and I'll also put the registration link in the chat. So without further ado, I want to welcome Dr. Dalia Nessim. Dr. Nessim is an associate professor of occupational environmental medicine at the University of Texas at Tyler. She also serves as the Occupational and Environmental Medicine Residency Program Director. She joined the Occupational and Environmental Health Science Department at UT Health Science Center at Tyler in 2014. She participates in both clinical and teaching activities, and she comes from a strong background in occupational environmental medicine after receiving her MD in Ain Shams University in Cairo, Egypt, where she also worked in environmental and occupational medicine for over 10 years before arriving to the US. She had an internship opportunity in pediatrics at the New York Beth Israel Medical Center in New Jersey and completed her occupational medicine residency and her MPH degree at the University of Texas Health Sciences Center in Houston, Texas in 2014. She is board certified in occupational and environmental medicine. She is an instructor with the MPH program and supervises residents and medical students and MPH students in research projects, capstone, and practicum experiences. Her primary focus is building healthy work environments for rural and vulnerable populations. She serves on several councils and committees at the university and is currently the chair for the Department of Occupational and Environmental Medicine. We want to thank Dr. Nessim for being with us today. And so you all know, she is also a core consultant for the Southwest Center for Pediatric Environmental Health. So we are so happy again. Thank you, Dr. Nessim, for being here. We're excited to hear what you have for us.
Thank you very much. Thank you, Dr. Monks. Let me go ahead and share my screen. Can you see my full screen now?
Yes, ma'am.
Okay. Thank you very much for the opportunity to speak today. I really appreciate it. It's my pleasure and honor to be presenting this topic, especially at the current times. It's a topic on time, as you may know. We are currently celebrating like the Climate Change Week, so currently on time. First, disclosures, no disclosures. As Dr. Monks mentioned, I'm currently faculty at the University of Texas at Tyler School of Medicine and one of the consultants for the Southwest Center for Pediatric Environmental Health. Before I proceed, I would like to acknowledge and thank Dr. Larry Lowry. He's a former Southwest Center for Pediatric Environmental Health consultant and currently faculty emeritus, professor emeritus at the University of Texas at Tyler, for his contributions and advice to this presentation, as he's an expert in this field. So first of all, what is climate change? So according to the United Nations, climate change refers to long-term shifts in temperatures and weather patterns. Such shifts can be natural due to changes in the sun's activities or large volcanoes, or human-made. Since the 1800s, however, human activities have been the main driver of climate change, primarily due to the burning of fossil fuels like coal, oil, and gas. Burning fossil fuels generates greenhouse gases, emissions that act like a blanket wrapped around the Earth, trapping the sun's heat and thus raising temperatures. Greenhouse gases are mainly carbon dioxide and methane. So what are the causes? These usually emission of carbon dioxide and methane usually come from using gasoline for driving a car or coal for heating a building. Also like plants and forestry, they help absorb carbon dioxide from the atmosphere. So deforestation, urbanization can contribute to climate warming. Agriculture, oil and gas operations are major sources of methane emissions. And energy, industry, transport, and buildings are among the main sectors causing greenhouse gases. So some facts: the average temperature of the Earth's surface is now about 1.1 Celsius warmer than it was in the late 1800s, that is before the Industrial Revolution, and warmer than at any time in the last 100,000 years. The last decade was the warmest on record, and we have the warmest 8 years being the last 8 years. Each of the last 4 decades has been warmer than any previous decade since 1850. 3 times as many extreme weather events occurred between 2000 and 2009 than between 1980 and 1989 with the natural disasters and so forth. The frequency of reported natural disasters have increased over the past 40 years. So this is from the Intergovernmental Panel on Climate Change, and the report projects that in the coming decades, climate changes will increase in all regions. For 1.5 Celsius of global warming, there will be increased heat waves, longer warm seasons, and shorter cold seasons. At 2 degrees of global warming, heat extremes will be would more often reach critical tolerance thresholds for agriculture and health. But it's not just temperature. Climate change is bringing multiple different changes in different regions, which will all increase with global warming, with further warming. These include changes to wetness, to dryness, to winds, snow and ice, coastal areas and oceans. So the effects are environmental changes, weather changes, and health changes. And Earth is a system with connections, thus the domino effect. Change in one area can have effect in multiple other areas. So climate change regarding the environment is intensifying the water cycle. This brings more intense rainfall and associated flooding, as well as more intense drought in other regions. Climate change is affecting rainfall patterns in high latitudes. Precipitation is likely to increase, while it is projected to decrease over other large areas of the subtropics. Coastal areas will continue to see continued sea level rise, contributing to more frequent and severe coastal flooding in low-lying areas and coastal erosion. Extreme sea level events that previously occurred once in 100 years could happen every year by the end of the century. And further warming will amplify the permafrost thawing and the loss of seasonal snow cover, melting of glaciers and ice sheets, and loss of the summer Arctic sea ice. Thus, we've been seeing more flooding, and I'm sure you all noticed, like in the news, these flooding catastrophes have increased incredibly over the past year or two. Sea level rise, ocean changes, heat waves in the ocean, increased temperatures in the ocean, and increased fires and wildfires. An example is the most recent flood in Libya, where a massive flood hit Libya's northeast. There was destruction by water and sand, collapse of 2 dams, infrastructure destruction. At least more than 5,000 were dead and 10,000 were missing, and more than 30,000 were displaced. The heavy rainfall was a result of a very strong low pressure system, which brought catastrophic flooding, developing in a tropical life cycle. So this is a slide like from the CDC, an interactive slide explaining like the domino effect, how like the primary effects of increased rising temperatures, increased CO2 levels, rising sea levels can lead further to air pollution, which can further exacerbate asthma and cardiovascular disease, and can also change the vector ecology, and thus like increase like vector-borne diseases like malaria, dengue, and Lyme disease. Can increase the allergen season, increasing pollens, and the allergen season increasing also respiratory allergies and asthma. There are water quality impacts due to the flooding and increased rainfall, which can increase waterborne diseases, including cholera, cryptosporidosis, and Campylobacter, and also like increasing the harmful algal blooms. There are water and food supply impacts, which can cause malnutrition and diarrheal disease, and GI diseases, other gastrointestinal diseases. Environmental degradation will cause forced migration with civil conflict and the mental health impacts resulting, and of course, increased injuries and accidents. Extreme heat causing heat-related illnesses and death, and cardiovascular failure. And of course, the severe weather and natural disasters causing injuries, fatalities, and of course, the mental health impacts. So health effects of climate change, primary effects would be affection of the food, water, air, and shelter. This may affect severity of pre-existing diseases or even create new health problems. So in addition to heart and lung diseases, climate change may increase vector-borne illnesses, as we mentioned, Lyme and mosquito-borne illnesses. There is increased rate of injuries and crimes and accidents and poor mental health. However, the total impact on health is complex and often indirect. And some other factors might play a role, like societal and environmental factors. For example, like a family's income, the quality of their housing, the community's emergency management plan can all affect that family's exposure to extreme heat. The degree to which their health is affected by these threats and their ability to adapt to the impacts of extreme heat or climate change. So this slide is from the EPA, Understanding the Connections Between Climate Change and Human Health. So there are three factors to determine vulnerability. Like there are some like environmental injustice or climate change injustice. So not everyone is affected to the same degree. So the three factors that determine are exposure. For exposure is the contact between a person and one or more biological or psychosocial, chemical, or physical stressors, including any stressors by climate change. The sensitivity of those individuals or those populations is the degree to which people or communities are affected adversely or beneficially by their exposure. And then the ability to adapt, like adaptive capacity, the ability of communities, institutions, or people to adjust to potential hazards. This all will determine the vulnerability of human health to climate change and thus determine the health outcomes, which would include injury, acute and chronic illness, developmental issues, and death. It's also important to remember that the different health impacts identified here do not occur in isolation. People can face multiple threats at the same time at different stages in their lives or accumulating over the course of their lives. Risks may increase as people are exposed to multiple health threats. For example, extremely hot days can lead to heat-related illness as well as poor air quality, thus increasing the chemical reactions that produce smog, thus increasing respiratory illnesses. So vulnerable populations, based on this, there are some populations that are more vulnerable than others, depending on the exposure level, again, the differences in sensitivity and the ability to adapt. So exposure levels, low-income populations would probably be more exposed. Certain occupational groups, like those working outdoors or those working in certain occupations, can have more exposure, and of course, certain geographic areas. Differences in sensitivity due to the individual factors, like, for example, pregnant women, pre-existing conditions such as asthma and heart disease, and of course, children. And then the ability to adapt, which is probably a characteristic of the community itself, whether there is like disaster preparedness, adequate response system to disasters, and adequate mitigation. So of course there is some vulnerability here due to low income and underdeveloped countries and low socioeconomic status, and also the elderly and the disabled. So coming to the impact on children. Children are uniquely vulnerable to climate change due to a variety of physical, cognitive, behavioral, and social factors. Children's bodies are developing physically, which can make them more vulnerable to climate-related hazards like heat and poor air quality. They, for example, breathe at a faster rate, increasing their exposure to dangerous air pollutants. They also tend to spend more time outdoors than adults, increasing their exposure to heat, cold, or rain and snow, or outdoor allergens or insect bites. Also, like, for example, in swimming, they drink more water. They tend to swallow more water while swimming, so they will be affected by water pollution and the risk of developing gastrointestinal or other illnesses. They're also developing emotionally as well, and the brain continue to grow and develop throughout adolescence. They can experience mental health impacts from major storms, fires, and other major disasters. They can also suffer like from other mental health problems due to relocation or disruption of normal life, or being moved away from caregivers and so forth. So not only like will this vulnerability make them more liable and more impacted by the effects of climate change and the diseases resulting, but it can also have like some effects on their development, on learning, and chronic diseases in general. So it can have some lifelong consequences even after the event or after the disaster. They're also more vulnerable to extreme heat and wildfire smoke because of their size, physiology, and factors also that include spending more time outdoors, having less control over their environment, and exposure to harm. So the EPA just released like a report that was released just last April, Climate Change and Children's Health and Well-Being in the United States. So this infographic was taken from there, and it also explains like how climate change may interact and affect the health of children. So again, seasonality, like changes in season due to climate change, may increase exposure to aero allergens like pollen, leading to higher rates of seasonal allergies and asthma. These changes may affect opportunities for outdoor recreation and play. Air quality, changes in air quality and worsening air quality due to increased particulate matter, ozone, and dust. And wildfire smoke might increase emergency department visits, and in addition to exacerbating existing asthma, new asthma also may develop in vulnerable children and increase general respiratory illnesses in general and preterm birth and low birth weight. Flooding again may increase rates of home damage and loss, drowning, stress and mental health impacts, and exposure to waterborne pathogens and mold afterwards. Extreme heat has been shown to impair learning and cognition, can impair sleep, mental health, kidney and liver function. It may increase, and it's known that emergency department visits for children are increased between May and September due to the exposure to extreme heat. And of course, infectious diseases. As we said, climate change may expand the ranges and active season lengths of insects and ticks that carry vector-borne disease. So heat illnesses, it's the most direct effect of climate change. We've all noticed, like last summer, how August and July were really hot, and how most of the days the temperatures were above average. In fact, they were, I think, one of the most hot months on record. So heat illnesses, young children and infants are particularly vulnerable to heat-related illnesses and deaths, as their bodies are less able to adapt to heat. They have a greater surface area to body mass ratio. They have a lower rate of sweating and slower rate of acclimatization to heat. So thus a child's body temperature can rise 3 to 5 times faster than an adult. And of course, like underprivileged children who have no air conditioning in either homes or schools are especially at risk. And hot car deaths is really an issue in children, which is increasing due to the increased heat, climate warming, and increase of weather temperatures. So in 2022, 33 children died of heat stroke in vehicles. In 2018 and 2019, there was a record number of hot car deaths. Respiratory illnesses, increase in outdoor air pollutants, e.g. wildfire smoke, ground level ozone, can lead to asthma and other respiratory conditions. Also, increase in pollens lead to increase in the allergy and can prolong the allergy season. Increased heat can also lead to children spending more time indoors with exposure also to indoor air pollutants as tobacco smoke and mold, and can also lead to decreased physical activity since they are bound indoors and not going out to play, which have detrimental effects on their physical and mental health as well. Water-related illnesses, increased rain and flooding can increase pollutants and organisms in the water, can contaminate recreational waters and drinking water supplies and cause harmful algal blooms. This increases gastrointestinal diseases and eye and ear infections. Children are usually more vulnerable than adults because of both increased exposure and increased sensitivity. As we said, they can spend more time swimming in lakes, swallowing more water while swimming, and of course, they spend much more time outdoors. Insect and tick-related diseases, vector-borne diseases in general. So climate change is expanding the habitat ranges and length of time when insects and ticks are common. So they affect also the development phase of insects. It has been shown that the development of mosquitoes increase with increased temperatures. Increased rainfall also can increase breeding sites for mosquitoes, and increased temperatures can increase their development rates. Thus, there is an increase of vector-borne diseases such as Lyme disease, West Nile virus, and many others. Mental health effects as a result of natural disasters. So it's multifactorial, increased anxiety, depression, post-traumatic stress disorder. However, the distinctive health and behavioral and psychosocial needs of children subject them to unique risks from these events. So extreme weather events can place children at risk for injury, loss or separation of caregivers, exposure to infectious diseases, and a uniquely high risk of mental health consequences, like post-traumatic stress disorder and adjustment disorders. So again, and can cause harm and disruption to their lives through also devastation of their homes, schools, and neighborhoods, all of which contribute to the psychological and cognitive development. So solutions and mitigation and adaptation strategies. So in a series of UN reports, thousands of scientists and government reviewers agreed that limiting global temperature rise to no more than 1.5 Celsius would help us avoid the worst climate impacts and maintain a livable climate. So progress is already underway, from more green energy to more secure food supplies. Benefits are clear. There are various global agreements, Sustainable Development Goals, Convention on Climate Change, and the famous Paris Agreement. Actually, the UN Secretary General is convening a Climate Ambition Summit just this week. Actually, it was just yesterday. Main mitigation is to cut emissions, among others, to adapt to climate impact. So most importantly, switching to renewable energy sources, such as solar, wind, or hydroelectric power, means less pollution. Currently, around 80% of the global energy and 66% of electrical generation are supplied from fossil fuels. This needs to shift. Regarding adaptation, so this is mitigation to decrease emissions. Adapting is climate change is already here, so we need to have like adaptations in place to decrease the impact, especially for vulnerable people. This would include like disaster preparedness, like early warning systems for disasters and proper disaster management. A third of the world's people do not get early warnings of extreme weather. So parts of mitigation, net zero, Put simply, net zero means cutting greenhouse gas emissions to as close to zero as possible, with any remaining emissions reabsorbed from the atmosphere by oceans and forests. Currently the Earth is already about 1.1 Celsius warmer than it was in the late 1800s. Emissions continue to rise. To keep global warming no more than 1.5 degrees, this was called for in the Paris Agreement. Emissions need to be reduced by 45% by 2030, and we reach net zero by 2050. So to tackle climate change and its negative impact, leaders at the UN Climate Change Conference in Paris reached a breakthrough on December 2015, the historic Paris Agreement, which set long-term goals to guide all nations and substantially reduce global greenhouse gas emissions to limit the global temperature increase in this century to 2 degrees Celsius, while pursuing efforts to limit the increase even further to 1.5 degrees. Countries review countries' commitments every 5 years and provide financing to developing countries to mitigate climate change, strengthen resilience, and enhance abilities to adapt to climate impact. So the agreement is legally binding, international treaty. It entered into force in November 2016, and today 196 parties have joined the Paris Agreement. So again, its overarching goal is to hold the increase in the global average temperature to well below 2 Celsius above the pre-industrial level, and again pursuing efforts to limit the temperature increase to 1.5 above pre-industrial levels. So this is a landmark in the multilateral climate change process, because for the first time, a binding agreement brings all nations together to combat climate change and adapt to its effect. So it works on a 5-year cycle of increasing ambitious climate action carried out by the countries. Since 2020, countries have been submitting their national climate action plans, known as the Nationally Determined Contribution. And each successive national determined contribution is meant to reflect an increasingly higher degree of ambition compared to the previous version. And we're still falling short, probably. We're probably not achieving like these goals yet. Adaptation. So since climate change is already occurring, beyond doing everything we can to cut emissions and slow the pace of global warming, we must adapt to climate consequences so we can protect ourselves and the communities. So we need to become more resilient to climate impacts. This requires large-scale efforts, many of which are orchestrated by governments. So, for example, roads and bridges need to be built or adapted to withstand higher temperatures, more powerful storms. Some cities on coastlines may have to establish systems to prevent flooding in streets and underground transport. Mountainous regions may have to find ways to limit landslides and overflow from melting glaciers. That may include even some communities needing to relocate. This is already happening in some island countries facing rising seas. So all parties to the Paris Agreement committed to strengthen the global response to climate change by increasing the ability of all to adapt and build resilience and reduce vulnerability. Not only on the large scale and governmental agreements and so forth, but also simple individual measures such as planting and preserving trees, large-scale measures, of course, as natural disaster preparedness. The goal is mostly to increase resilience, decrease vulnerability to climate impacts, especially in the underprivileged populations and those who are impacted the most by the disasters and climate change. So what's your role as a healthcare provider? So as a healthcare provider, especially like as someone dealing with families and children, there are medical education opportunities where you can educate the effect of climate change on the environment and children's health. Act as a role model where we can start by ourselves, reduce the carbon footprint, for example, in healthcare facilities, reduce waste, increase energy efficiency, promote public and active modes of transport, e.g. biking, and being a role model to the society. During visits with families, discuss topics, educate, for example, like educate parents of children on limiting time outdoors in hot weather, educate them on proper hydration in all temperatures, how to recognize the early warning signs of dehydration and overheating, the risks associated with excessive exposure to high heat, empower patients to know how to advocate for safe practices and outdoor activities. Also educate like vulnerable families, like families of children with asthma. For example, they can check the air quality index forecast and have an action plan for their kids. Also encourage families to have like psychological support for children impacted by natural disasters. Educate families on mold cleanup, appropriate measures for avoiding exposures to ticks and mosquitoes, and water safety, and all of these like can be our role as healthcare providers dealing with families with children. Also educating on identification of early symptoms such as like the tick bites and how to protect from ticks, mosquito bites, and recognition of early symptoms like, for example, the Lyme disease rash, the erythema migrans rash. So in conclusion, climate change can affect all aspects of life, including health and safety, and definitely economy. Children are especially vulnerable to the effects of climate change. Mitigation and adaptation strategies are available. There is big progress, but we're still falling short, to be honest. And these are my references. And that's all I have. So if there are any questions, thank you. Thanks for your attention.
As we wait for questions, I want to bring your attention to the chat function. There you will find the link so you can receive your CME credit hours. So if you click on that link, that should take you to the page to enter your information in. Dr. Nessim, will we be able to get these slides out to the audience? Is that a possibility?
Yes, sure. I can send you a copy of the slide.
Thank you. Wonderful. Are there any questions?
I think someone was raising their hand. I saw someone raise their hand.
Okay. Dr. Crawford, can you see if you see that on your end?
Just two quick questions. Will the slides be available? And another is a comment, reporting great presentation. And a question, should we ask parents to use stronger UV protection like 50 instead of 30?
So I'm not really familiar with like the maximum level of sunscreen protection and what level they need to be. Yeah, I'll have to look that up, whether there is any advantage of using 50 instead of 30. Yeah, trying to see the chat.
There was a second part to that question. Should we teach parents and children to wear caps and hats outside?
Yes, definitely. Yes, for sure. That's one of the most of the methods of sun protection. So wearing sunscreen, wearing protective clothing, wearing hats and caps, being not outdoors in the timing of the most sun, like noon to the afternoon. So these are all good education points.
Another question says, you included that the change in temperature was 1 degree Celsius since the 1800s. How urgent are our interventions as a result?
So it is urgent. It is urgent because they want to cap, like they have a goal of that increase not being more than 1.5. And the way the emissions and the way the climate is warming up, it is going at a steadier level and will increase much more than that unless urgent interventions are taken seriously.
Thank you. And there's another comment in the chat, says that the SPF level in sunscreen refers to the relative duration of time that it takes to burn versus not wearing it. So for example, if you burn in 2 minutes, the SPF 30 would increase that to 60.
Yeah, I guess, yeah. And even more important than the SPF is like always wearing the sunscreen. So always applying it, especially like if you're outdoors, like for a longer period of time, or if you're swimming, reapplying would be important.
Okay. If we don't have any further questions, I am putting my email in the chat box. You can send me your questions directly, and I can get those off to Dr. Nessim. And then those of you that would like the slides, if you would please email me so I can get those to you. Again, if you look in the chat, you'll find the link that you need for the CME credit hours. So if there's nothing else further, we can go ahead and stop the meeting. Thank you all so much. Have a wonderful day. And we'll see you back on October 26th to hear about radiological exposures in children. Have a great day.